COVID-19 isn't the only concern right now. Flu season is just beginning, and some worry a severe season could result in patients with serious illnesses, and those patients could even overwhelm hospitals. CBS 17's Maggie Newland spoke with doctors and joins us live. Hey, Maggie.
Marius, you can get a flu shot at just about any pharmacy these days, and one doctor I spoke to tells me that more of his patients got a shot this year than ever before. He hopes that will be enough to help reduce the severity of the flu season, even as COVID cases rise. With similar symptoms, it's tough to tell the flu from COVID-19.
My biggest concern is that we're not going to be able to differentiate who has what, and we're going to be putting people in situations that put them at risk.
Dr. Michael Sabiro with WakeMed Primary Care says patients with respiratory symptoms will be evaluated by phone, then tested with minimal contact.
You walk to one specific room, a gowned, gloved, masked, and shielded, a medical assistant's there. They'll swab you for flu and COVID, and you go home.
Probably one of our biggest fears is the combination of both.
Dr. Ryan Lamb, chair of the emergency department at UNC Rex Hospital, worries about the possibility of a severe flu season as COVID cases rise.
It will be devastating to our healthcare system. You know, each year we get overwhelmed during flu season alone.
Rex already has a COVID unit and isolates patients with infectious symptoms.
Where we're going to have problems if we're too overwhelmed and those rooms are all full. The other place we'll have problems are the people who aren't symptomatic but are able to spread it.
Another possibility, patients could come down with the flu and COVID at once. Duke has already seen a suspected but unconfirmed case of dual infection.
You essentially have two viruses both attacking the lungs.
But the treatments aren't the same.
There are treatments that you give for COVID that are not appropriate for the flu.
Although they're concerned about COVID and flu season colliding, doctors also have hope that the same precautions we take to protect ourselves from COVID will protect us from catching the flu. And they talked specifically about the flu season in Australia, which was much more mild than it usually is. Again, we're only at the very beginning of flu season here. The doctors I spoke to had seen only a couple of cases for one, none for the other. But they say now is the time to wear your masks, practice social distancing, and wash your hands. And hopefully we won't see a severe flu season. We're live in Raleigh. Maggie Newland, CBS 17 News.